Let's bring in ABC News contributor and emergency physician Dr. Darien Sutton for more. So, Darien, 3 states have now imposed health emergencies as monkeypox spreads. You've got New York, Illinois, and California. So what good would a federal health emergency actually do?
I think it's really about language, Kira. When we declare something a federal health emergency, it also increases not only the intention of everyone to pay attention that this is a serious problem in a symbolic way, but it also helps with physical representation, increasing funding, access to testing and vaccination. I think it is a necessary step to get a hold of this virus and to act in the most important way, which is prevention.
So the U.S. has recorded more than 5,800 known monkeypox cases in men, women, and now 4 children. So what more do we know about how this virus is spreading?
Well, number one, we understand that the majority of contacts or spreading within communities happens via close contact. It often seems close contact from individuals who are infected and actively symptomatic. And Kira, I reviewed a recent study that came out from the New England Journal of Medicine, and it looked at over 500 patients infected with monkeypox from the months of April to this past June of 2022. And it found that more than 60% had 10 or fewer lesions. And why I think that's important is because I think that although we see these dramatic views of what monkeypox could look like, I think often it is transmitted in the community unknowingly, as many people have mild symptoms and don't realize that they're actively infected with monkeypox.
And so what more have we learned about how long it takes to actually realize exposure?
Yep. So that is a question of what is the incubation period, or the time from exposure to the onset of symptoms. And what we've seen in the patient population during the current circulating strain of monkeypox is that the average amount of time from exposure to the onset of symptoms is approximately 1 to 3 weeks. And it seems as though people are most infectious or actively infectious when they're symptomatic. So when that rash develops, when that flu-like illness or fever, that is when someone is most infectious to other people and needs to be isolating and also contacting their Department of Health to seek if they need any treatment or additional instruction for remaining in that isolation.
And currently, vaccines and the antiviral drug for monkeypox are not readily available to everyone, right? So there was this statement that came out from the White House that says it's going to accelerate the U.S. monkeypox response to mitigate the spread of the virus, protecting those most at risk. Has the language changed now on who's most at risk? And what's the latest on this front now as we now read this statement from the White House as well?
Well, the language is starting to change. Many people have this misinformation that this is a quote unquote a gay disease, which is an unfortunate definition of this circulating virus. And the reason why that's unfortunate is because everyone and anyone is at risk of getting infected. When we first start to see viruses and bacteria transfer within communities and cause transmission and outbreaks, we often see that first initial transmission in self-associating social groups. That's how we identify meningitis in colleges and hepatitis among food workers, and also polio and measles within Orthodox communities. And then, depending on the level of infectiousness or method of transmission, that pathogen, that virus or bacteria can spread into the community. And this is what we are starting to see. As we saw initial cases, and the majority of whom were defined as gay and bisexual men, we have the threat of risking the entire population. So I think it's really important that everyone understands that they are at risk.
So Robert Fenton will now head this new position and coordinate monkeypox outbreak, kind of like what Fauci did for COVID, right? What will his role be like? He used to be with FEMA. Now he moves into this role. What exactly will he be doing?
Well, I'm excited to see what he will do. Only time will tell. He's had tremendous amounts of experience in national emergencies, and I think him, as well as Dr. Dimitri Daskalakis, who has experience in HIV prevention, working with the CDC, I'm hopeful that they will be able to coordinate messaging and information, because that is what's most important. Vaccines are definitely important for those who are high risk, but we need to educate people about what this looks like and how to prevent it.
And don't forget, you can always head to the CDC website as well and get all the latest information, in addition to what we have, of course, for our viewers. Dr. Darien Sutton. Darien, thanks.
Of course.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.